Medicare for All, or any other way of covering everybody in the U.S., is impossible unless we could do it for less, way less, than healthcare costs us today. What? But imagine what if for a moment with me. Imagine covering everyone, taking care of everyone, and it costing less than what we pay today. Less for the government, less for employers, less for you, way less. Half or less. How could that be possible? Now, this is really kind of a red pill moment, because once I lay this out for you, you really can't unsee it. The whole thing costs us about $3.9 trillion per year. That's about 5 times what we pay for the most powerful military in the world. A big chunk of that is wasted on doing things that are really not necessary. So that's somewhere between $1 and $2 trillion every year flushed away on stuff we don't need to do. The great majority of this nearly $4 trillion is spent on categories of disease that are chronic, that are behavioral, that are environmental. What these all have in common is that they are, to some extent, preventable and have been shown to be manageable. We know how to do that. Prevention and management is almost always way cheaper. We don't do this prevention and management. It's a lot. It's a majority of the nearly $4 trillion. Now, if we could reduce that cost by half, or even 25% by smart management, we are talking hundreds of billions to $1 trillion or more per year saved. Costs would come down. All this is based on the prices we pay for healthcare in this country right now. But what if the tremendous costs of the U.S. healthcare system are not because it's the greatest system in the world? What if the costs are mostly bogus? What if smart system redesign could result in a system that is not only better, but costs half as much or even less? Then of course we can afford to take care of everyone. The system we have just pays for fee for service. That is, a fee for each individual service. The system we have has almost no transparency. It is built on opaque, secret contracts, monopolistic practices, many of which, to me, look like little more than legalized corruption that allow everybody involved in this game to jack up the costs and take a bigger and bigger cut. What if we flip these? There are lots of ways to puncture the system, and costs will come down. Lots of ways, lots of ways. Don't let anyone tell you that we can't do this in America. We can. There are lots of ways. Change not just who pays for healthcare, but also the way we pay for healthcare and what we're paying for. And we can rebuild the system to be at the same time better and far cheaper.